It has a population of 2,162,107 in an area of 7,510. We are the third biggest county in Kenya. Currently, we have a total of 150 COVID-19 cases recorded in Nakuru. The cases are distributed across the 10 sub-counties, with truck drivers forming majority of those infected. The breakdown of those infected is as follows. We have 72 alert cases, 42 truck drivers, 15 food handlers, 5 healthcare workers, and 9 contacts with infected patients and 1 inmate. Initially, the cases were imported, but currently the transmission is at community level. Cases from other counties are at 27%, and 73% is through local transmission. By gender, out of the 150 cases, 119 are male, with 31 being female. Those infected are aged between 1 year and 72 years. In terms of distribution, the disease has spread in our 10 sub-counties. Nakuru town, which comprises of Nakuru town east and west, consists of 24% of those infections, followed by Naivasha at 21%. Waziri, I also wish to bring to your attention that Nakuru has been identified as a high-risk county due to the high population and central location of Nakuru within the larger northern corridor. For this, the county appreciates that because of the long-distance truck drivers who commute from Mombasa all the way up to our borders, and also from the newly operationalized Mahiu depot, the risk has increased significantly, especially in the last few days. On public health promotion, the public health activities are being carried out with health messaging being disseminated through all media platforms, and this includes the mainstream media and social media. We are particular on hand washing, social distancing, and wearing of masks, and as a county, we have also invested significantly to ensure that provision of these masks, especially the reusable ones, are made available to the public. The message is widespread, but public response has been varied, and we wish to take this opportunity to urge our citizens and our residents of Nakuru to be vigilant and ensure that at all times they comply with the Ministry of Health guidelines. Just before we came here, Waziri, we visited our community health volunteer training program that is currently taking place just next door. And I want to take this opportunity to say that Nakuru County has been using our community health volunteers as a way of ensuring prevention and mapping out all cases that have been identified. We wish to emphasize that through our community health workers, we are able to train the public on home-based care, noting that in a few coming weeks, we may not have the capacity to admit all confirmed cases to our hospitals. I also wish to note on a few interventions that we have made so far as a county government. And the first one is that isolation centers have been established at Nakuru Level 5 Hospital, where we are today. We also have Naivasha Sub-County Hospital and Langa Langa Hospital right here in Nakuru. There are plans to set up isolation centers at the new OPD block in Nakuru Level 5, where we anticipate to have 500 beds. We also have Gilgil Maternity that will be converted and will have 100 beds. We also have Bondeni Maternity, the new OPD block in Naivasha, the Total Dispensary, Sachangwan, Kabazi Health Center, and Nyamamithi Health Center. Out of all this, we hope to have an additional capacity of 1,000 beds. Currently, there are 38 admissions, 17 at the PGH Isolation Facility, and 11 at the Naivasha Isolation Facility, and 10 at our Langalanga Isolation Facility. The county has a surveillance vehicle that we received from your ministry and ambulances committed to the response of COVID-19. And for this, we also wish to thank your ministry for the good partnership that we have had on this. 329 health care workers have been recruited through the County Public Service Board and 86 through the Universal Health Care. They will soon undergo induction and training planned. But this number, as you can imagine, remains largely low. And with 1,000 beds planned, we believe we'll need double that number. And therefore, we'll be visiting your office to see how we can partner to increase the number of healthcare workers available for the response to the COVID-19. On equipment, the county has 49 non-invasive ventilators and 5 invasive ventilators received from the national government. The county has so far distributed a total of 350,000 masks across the sub-county. Most of the masks are produced in our TVETs in the county, and we target to produce 55,000 masks per week. And this does not only help in giving the masks, but also to reignite economies back in our rural areas. In addition, the county has allocated a total of 250 million for food distribution and cash transfers to the vulnerable members of the community. The county has also given food to those in quarantine at our centers and at their respective homes. And this is given by the fact that those who are on quarantine in their homes and can no longer go to work require to feed. And therefore, the county has been monitoring this to ensure that we support them and we don't force them to go out to look for food or work during their difficult moments. To enhance hand washing, over 500 water tanks were strategically placed in markets, bus parks, and other public areas. And as a county, we want to say beyond the provision of this, I think it is important that the public understands the need to constantly wash, not just wash, but wash within the recommendations given.